help them. You know, they have no family members. They're on quarantine, and you can understand why everybody is really concerned. Even the chief implementer, you know, from the IATF, which is the policy making big body, the implementer goes to the National Task Force. The National Task Force is with Secretary Galvez. Now he also he has with him, of course, the implementing team, the one for contact tracing. But more than that, he is also alarmed, and he called, you know, the our religious leaders to look into this. Then he's also calling the experts and the workplace. You know, we have to, as physicians, please understand the anxiety, the fear. We're 9 months into COVID, and we have no cure. We have no vaccine. You can understand the people who go out. The fear is there, and especially if you also have vulnerable sectors in your home, you really are going to carry a burden in terms of mental health. Now, so this is, we put in the numbers they can call. And I also like to inform you that if you go to the BWC website, we have more numbers there for mental health. I know here, PCOM, you've been running a webinar on this as well. So please note and keep tabs of these experts. You would like to share them with the workplace, because the workplace really would need all of this assistance in this concern. Now, what is new and what is not new? Well, definitely, if you look at the second strategy on reducing transmission, we still talk of masks. They still should be worn. That is already the minimum public health standard. It is there. You can still use the two types, the cloth and the medical or surgical masks. The N95, we always say, leave it, it has 95% protection. Okay, leave it to the healthcare workers. In fact, you know, when it was shown to the government agencies, they were even saying N95 carries more than a 95 protection. It even could carry all the way to a 99 if the proper fitting was, if it's really properly fitted. But more than that, the medical surgical masks are, of course, already giving you protection. Cloth masks as well, because it provides the barrier. But of course, the protection of cloth masks will be less. And that's why we also say, please add more filters. You can add the tissue paper. Actually, cloth masks really have not much of a protective a percentage of protection. Kasi medical and surgical masks, the blue, the pink that we see around, it carries like an 70 to 80% protection for the wearer. So it's of the N95 is, like I said, but if you add on the face shield, that's why we had, it was a discussion. It was not put there right away. No, it was presented, to the agencies, and they said, you add on the face shield, you will add up more protection to the wearer, and that is what we want. We want that we are protected. We also want that, because I think we know that our mindset is that it's the person I am, it's my coworker as an asymptomatic carrier, or am I an asymptomatic carrier? So you'll do all the necessary protection. One, if you do not know if you're interacting with an asymptomatic carrier, you'll do all precautions to protect yourself. And if you might be one, you will also do everything so that you will not transmit. Mask plus shield will carry a protection all the way to 93 to 95%. And that's the medical mask plus a face shield. So see naman the percentage of the protection that is given. When we say wear face shields, we do not mean all the time, because that was also a big question that was given to us. They say, you let us wear face shields, it's going to interfere with our work, then take it off. If there is a safety and health issue, if you wear your face shield, do not use it. But when you start interacting with other co-workers, you again add that level of protection, add that additional protection. And it is really another way of really putting in a preventive mechanism so that we are putting down the risk in terms of the possibility of being infected or infecting others. So that is where we're now seeing, and that is the rationale why face shields was added on to the masks. Uh, then you add physical distancing. The 1 meter will always be there as a minimum. We would like more, really. We would like the distances. Now I just saw a letter just as we were going to start. I was going through my the Viber groups, and I think the Philippine College of Physicians already wrote to the president as well as Senator Go on the move of the DOTR to lessen the distances, the physical distancing measurement in public transport. They were alarmed and they were saying it is really going to possibly again increase the risk. And we are being very cautious lang, but again, kasi it's so hard when you start looking and balancing health and the economy and opening up and knowing there are so many people who also need to go to work, but public transport is limited. But this is being studied. So I'm not sure if, kasi parang Monday yata, they're looking at a 0.75 distance na lang. I don't know how they will measure 0.75, but that's still on Monday. Or maybe next Monday, I do not have the information, the correct information to give you. But yes, they were looking at possibly bringing it down. But again, with all of this that's happening, with the concerns raised, I don't know how it's going to be addressed. But in your workplace, please understand, and we hope you understand the rationale for the 1 meter. If it's droplet, if you do not like that it goes anywhere near you, and that distance will be another means of putting you away or putting a distance away from somebody who could possibly be infected. So it's still there. It's part of the guidelines. And of course, together with this, if you look at the minimum public health standards, the frequent disinfection. Remember, when we talked of the first interim guidelines, this is to share with you, for those who've heard it, I'll repeat it again. Our interim guidelines, the first one, was a survey was done by the DOH to determine, how, and it was nationwide, how companies or the workers were aware of these interim guidelines, and if they knew what was in it and how they're practicing it. It came out that yes, they knew about frequent disinfection. They said they were practicing frequent disinfection, but when they were asked how many times they would disinfect their hands, they would say, oh, twice. Twice in a whole day is not frequent. It is still, of course, there's this, but then when we say it's frequent disinfection, we want to put in our mindset anytime you touch a surface that could be contaminated, including the masks, then you should wash your hands. In fact, now it's also being strengthened that when you touch your mask, before putting it on and then after or taking it off, you should wash your hands. If not soap and water, then alcohol-based sanitizers. This will work. And again, we're saying it's not just with a mask, anything you touch, even sometimes you might feel, oh, this is my table, my chair, but you don't know who passed by there and who, of course, if there was any droplets that fell on the surface. So that is why we just want that every time, if you can have that handy alcohol around you, there's nothing wrong to just keep on disinfecting, because if there's nothing in your hands, then nothing will enter your body, whether it's COVID or any other germs. So again, that is a mindset we want now, together with the mask, physical distancing, disinfection. Diba? Bida nga, huwag maging kontrabida. Bawal ang walang mask, isanitize yan, distansya. Pwede na akong DOH spokesperson. Tapos yung A, alamin ang katotohanan ng impormasyon. Anyway, okay. And because I talked of bida, the visual cues, the reminders, I hope you are you're all in workplaces. Ano ba naman na idagdag nyo yung mga reminders through posters, even if you have, even if your company would have to print it, you add on like that, that's fine. If you want it printed on, it's also good as long as it's there so that your workers will be reminded. It's not just in the entrance of buildings where they often pass. Always remind, these reminders are very good. And together with that, kasi what you notice, like even in our office, the stairways, way, o nga, nandyan na. One part going up, one part going down. Pero tama ba yung signage? Nakikita ba? Kasi minsan hindi naman nakikita. So you lose ba the value of what you did? So all we're saying is put it and where people can see it and be reminded of what behaviors they should follow, what practices they should do, what attitudes they have to protect themselves. These will also bring them in, it will go into their consciousness and they will bring it home. And they will now, their families will as well be oriented. So yeah, that's why that's part of the guidelines, because we saw that the awareness after the survey was run was low. And that is the reason why we will always have those reminders that are present, including now the mandatory advocacy awareness program. Have all of this, have online lectures, these webinars, and even put in videos by your companies in their websites. You populate it in their online, you know, through Facebook, in your company's Facebook. These are, as long as the information is true and and correct, put them there. There are so many. But yes, your workers will value them, because if not, they will look at Facebook and they will get the information, and more often than not, they will end up with fake news. And that's not what we want. Kasi how many times have I seen, even my husband, he would ask, he would show me from the Facebook, and I go, I would have to correct him. But that is his source of information. So do not make that their source. If you can provide from your company these online videos, materials, that you can, of course, you bring it down to them and tell them why this is the true, why, I mean, there's really, with COVID, it's evolving, all information is evolving, and that's why you will have all of these guidelines. Often we would have to update ourselves and sometimes even revise previous guidelines, but we give them what the science is telling us now. So please have this. It is very important. Now, we also now have shuttle services, because that was part of this supplemental guide. It was part even of the first interim, but here we are putting the term enjoining, which is highly recommending. We're not yet mandating, but there's a clarificatory that's going to come out where it may be mandated to really those firms who have very big capital, or who have assets of more than even 15 million. And it is now mandatory that they provide. Kasi nga, hirap nga ang public transport, hirap talaga ang workers. During the ECQ, it was seen that especially for those in the export processing zones, their work was allowed to continue because these were essential services that were allowed. And so that their workers can work. Remember, there was no public transport at that time. They had really to provide shuttle services, which they did. Now, kaya nga tinuloy ho namin dito na if you were providing those shuttle services, please continue. For those who have not, you can explore naman. We're not saying that it will be for free. It is saying that kung nagbabayad naman, namamasahe naman yung mga workers, baka you can look and explore what services can be provided. Look at those public utility vehicles that are not being used now, yung mga jeep, mga provincial buses. Then you have an arrangement with the workers so that they can they will pay for a certain amount, because they really pay anyway for their transportation going and coming from work. And this could be part of course of services provided by the employer. And again, this will also at least eliminate going, mixing in open and public transport, where you also do not know, who they are interacting with in the public transport system. If it is your company, it is their shuttle, and you are already there, you're doing all minimum public health standards, you are, you have already like clustered, or you have cloistered your workers to a safe zone. And that's why even sana on their way home, they're safe as they go back home, and they continue to be safe as they report for work. Now, in the shuttle services, there are minimum public health standards that we also look out for so that we avoid transmission, we reduce the risk. And that is, it's going to be self-explanatory. Wear the mask and the face shield, always. And as doing that, do not talk. It's, it's sabi, may mask na nga, may shield, do not talk pa. Bawas lang po ng pamamaraan para mag-transmit. We are still continuing to reduce the risk. Now, bawal lang kumain kasi magtatanggal ho kayo ng mask. Hindi naman ho kayo pwedeng kumain na nakamask. So pag nagtanggal ho kayo ng mask, nandun na rin ho na yung mga laway, lalabas, pwede mag-contaminate ng surface. Kung biglang nagsalita pa ho kayo, di nandun ha na you already, there was already a spread of this, of the saliva, the secretions in the, beside, in your nearby space. So, bawal ang kumain, bawal magsalita, pwedeng mag-text. And always disinfect. Together with frequent disinfection of the workplace, shuttle buses is also considered an extension of the workplace. Disinfect before the workers come in. As soon as they go out, disinfect. Before they come in again, disinfect. So these are all part of really addressing in the supplemental guidelines how we are looking at all the details now so that we reduce the risk. Again, there was a region where Secretary Galvez looked at in terms of suddenly those areas, the workplaces there had so much transmission, had so much cases of COVID. The shuttle buses were seen as part of this because in the shuttle buses, people were so comfortable. Okay, may one. And yung distancing nandun pa rin. We, yung governed naman ng public transport is by the DOTR, will be the public transport. But in shuttle buses, we have not changed naman the need for, or to revise that it is going to be less than 1 meter. We're still saying that the physical distancing of 1 meter should still be observed. So with that one, plus these should all be observed in the shuttle service. So now let us look at another mechanism of reducing transmission, which is ventilation. Ventilation inside the workplace and ventilation in the shuttle buses. When we said adequate ventilation, yes, we are promoting use of the natural ventilation, windows, doors, open it. You can open your aircon, but still, it's still best that you have your windows open so that there's, the exchange of air from contaminated air into air without contaminant, because it's coming from the outside, as long as it's non-contaminated. But that is what we are promoting. Now the question is, wala ngang bintana sa workplace namin, bawal ang bintana. Maglalagay ba kayo ng bintana? Siyempre hindi ho. Huwag ho kayong maglagay ng bintana kung hindi ho kailangan. And besides, kung wala talagang bintana doon, may mga pamamaraan. We are talking of filters. Kung hindi naman pwede ang mga filters, nandun pa rin. Talk to the safety officers. They know how to provide that air exchange that is necessary. If you ask what is the enough air exchange, it will depend on the area, on the work area. So we leave that up to them. But what we're saying is, please have these necessary mechanisms where there is an exchange of air from where there is free flow of non-contaminated air, outside air, and the release of contaminated air to the outside. So this is covering the ventilation inside. And also, offices are enclosed. We were using the term confined, but they're enclosed. That's why again, in enclosed spaces, you will understand, we're talking safety and health. So you understand that if there will be any hazard in the air, until it is brought out, it is there. So that's why you would like that air exchange to happen, so that whatever is present in the contaminated air is brought out. The same, of course, for the shuttle buses. Studies have shown, you've seen that internet, open the windows for 3 inches, then there will be that good air exchange and it will really reduce the risk. But we still say, still continue wearing the mask and the face shield. And then you'll also ask, and there are those shuttles or those transportation that will not have open windows. Then fine, do not open the windows, but you make sure that the air circulation is also open so that outside air is brought in, and there's also a way of the inside air to be brought out. So these are what we are stressing and emphasizing. Now, if it rains, definitely you cannot open your windows. So again, have that air circulation even in vehicles to bring in, like I said, that exchange of fresh air and bringing out of contaminated air. On the strategy of reducing contact, we are talking of those most at risk. It is part of the, actually, when the DOH was giving its guidance, including the minimum public health standards, 15 yata, if I'm not mistaken, because this was also even in the first interim, we were talking of the seniors, those pregnant, those with comorbidities, and those 21 years and younger, because they were all considered most at risk, and who are, it is really highly encouraged that they do work from home type of work arrangement. But, after seeing COVID through the months, and this was also in consultation, and this is also going to come out in the next clarificatory. So I'm already telling you, things to watch out for. Yes, we are considering that most at risk, even those with comorbidities, the pregnant, I'm being very careful with that kasi, it's kung pwede ngang, the work from home, but they can occasionally still, but then the 21 years old, so with medical certificate, can now report for an 8-hour return to work, as long as they're certified by the health practitioner that if when they go to work, it will not cause any undue effect on their health, or their risk of transmission is really not, you're guarding really very well that they will not be at risk for the transmission with COVID. So we are now looking at this because of, alam mo, it was so interesting. We were seeing the seniors who said, let us go back to work because we can. We will take, the necessary precautions are there, and the companies are saying, yes, we will give them the necessary precautions. We will not expose them to public. But then you see the younger workers who say, ayoko pa magtrabaho, nandiyan pa ang COVID. And you would see the clashing ideas between, and it's like, we had to, of course, work with the DOH here and said, kung may medical certificate naman, at pati may comorbidities, stable naman yung condition niya with all the, he's taking medication, it's not going to aggravate, and you are certifying that they can, then they will. And that is where, for now, wait for that, because now we're still saying that yes, they can report occasionally lang, this one, in the supplemental. But we are also opening that in the clarificatory, they can now do the full 8 hours. Huwag na lang ho natin ipa-overtime na, tama na po yan. Kasi most at risk pa rin naman sila. Umuwi na ho sila ng after 8 hours. But again, please wait for the clarificatory because it will still come out. But the OH also already gave its nod to this, to the item on the going back to work of those most at risk. But still, of course, our position is, if there is work from home and they can do it, it is still best. And the pregnant women, we still have, because they are very vulnerable because there is they're carrying a fetus, and it makes them. I don't know if you can extend fit to work to them. Then again, you can do that. But we're just saying, please exercise, all caution as you do this, because we're just, with that medical certificate, you're allowing them to go back to an 8-hour work. Reducing contact is also addressing that we are not putting workers together or having activities or mass gatherings where they may be exposed to, to many people, and we like it. We do not, it's not really at the present that these are activities that can really be avoided. So if for meetings, as in the first interim, we say have it on for those who can only be present. And ito nga, we're being very strict na only 10% if it is like you're in closed areas and your your quarantine here is on an ECQ, meaning you have high cases. And if it's low risk, like open spaces, and your queues are now on a GCQ or an MGCQ, then you may allow for at least a 50% of the seating capacity. Really try to limit, because you do not also like the concerns of having, if someone there tests positive or becomes positive or finds out that he is positive, paano na yung close contact? Because you will have close contacts here. Remember, you are together in an enclosed area, and it might be for more than 15 minutes because that is a meeting. But what we're saying here is, if it's really going to be a lengthy meeting, please do the VTC, do video conferencing. There are so many applications already out there. So please optimize those mechanisms. And mass gathering is also looking and addressing canteens. I mean, having meal hours, because people will gather. It's mealtime, it's 12. That's why first we're saying, okay, because it's already opening, you're opening up workplaces. There are workplaces na maski skeleton, it's your talk of 1,000, 2,000. Unang-una, sinasabi nga na staggered na po kami kasi paano man ipagkakasya ngayong 1,000 for lunch break. So there's already staggered. And then this time, your canteen, you are going to put all the necessary mechanisms again for the prevention, like 1 meter physical distancing, other barriers, between tables, and wala na, yung masks naman, kakain kayo, kaya masks are off. And that's why we are saying, please observe, all the other measures in terms of the minimum public health standards. Now, it is allowed that dine-in will happen, and if they cannot be accommodated in that one canteen and they cannot also eat in their workplace, then you can open up and have canteen type of areas, or putting, tables and chairs in the gym, in garage. We leave that up to the employers, but we are allowing that they can have this dine-in. What we are not, I think I already took it out, is that we're also not allowing that the buffet type, carinderia type of meal services will be resorted to, kasi you will queue up people. That's why we're saying, pack meal na lang so that they can get it, they can go to where they're eating, they eat, they disinfect, they wash their hands, and then they wear their mask, they go back. My daughter was telling me, because they were applying this at their workplace, and they're all allowed to eat in their own table. She was saying how sad it is, kasi nga, meal times are, for us Filipinos, the time that we interact socially with our friends, with our co-workers. But these are difficult times, and I was telling her, it was hard to, and for all of us, it's really hard to do this, but we have to really look at these mechanisms so that we can prevent. Our goal here is to reduce the transmission, reduce contact. And these are ways that we are, kumbaga, sinasacrifice lang natin ngayon so that we can bring down the numbers, and hopefully we will be able to soon beat COVID-19. So that is for the areas like that in reducing contact, the canteens. And before I go to the Safety and Health Committee, we also talked of the smoking areas, where it was also seen that this was an area where transmission happened. Kasi nga, where masks are off and you have an asymptomatic carrier, now you will see why you are increasing your risk. Now that happens when eating in the canteens, even in smoking, because you smoke. When you smoke, your masks are off. That's why the designated smoking areas should still look at the physical distancing. If it can be done in open areas, best, but then limit even the numbers of people who go into these smoking areas, and even in other common use areas. And if you see in this slide, we now talk of the safety officer who should be giving the number, the maximum number of any person at any one time in these common use areas, including bathrooms. That's why here you now see the importance and the responsibility of the Safety and Health Committee, because they should be implementing this program, as well as a safety officer, because he will have a responsibility in monitoring, in determining, ito sa canteen, ito talaga, ito lang yung number at any point in time, and it's on meal time, and in even the locker rooms, because again, it was seen in locker rooms, when they changed, tanggal ang mask, nandun na rin yung pagkukwento. Limit the number of workers in all of these common use areas, because again, we want to drive down the risk of transmission, the risk of contacts, and these are now the responsibilities of the Safety and Health Committee, the safety officer, as a health officer, because you're here both, you should also go around and check, because you will be surprised, you will see behaviors, you will see practices that are not, kumbaga, may again increase the risk of transmission of COVID. Now, okay, on reducing duration of infection, if you're unwell, what we always say is please tell your office and do not go to work. Now, the importance of the health declaration form, it was already there in the first interim, the symptom checklist, it is still there because it is a very vital piece of information, and it also drives a consciousness na if I will put a yes here, it means I will be assessed. It means I have to understand that I will not be able to work because one, I have a symptom that is COVID related. Two, if I put yes because I was exposed and I went to an area where there was a high incidence of COVID, I might be a carrier already. And that is why you guard against bringing that to the workplace. And that's why early on, sinasabi na filter them out. If you felt well in the morning and you went to work, then you suddenly discovered na your temperature was high and you are also feeling unwell, then they will now, please be honest though in answering the symptom checklist so that you will be able to manage, and the company should manage your health concern and other concerns, especially if you now check that you have been exposed, you might be a close contact, and you should be, and you should be quarantined. So this is the importance of that health declaration checklist. It's still part. Again, we will repeat, as I said before, it could be manual, it could be online. There are apps already pala available for this. We leave it up to you. Now, that is the first form. There's another form for the visitors and customers. It's a shorter form, but what we are also told is that pareho lang yung ginagamit ng restaurant, pati sa employers, actually sa visitors, pati sa dine-in sa restaurant, dapat ano na lang name yan kasi you're not naman going down to these restaurants and barbershops if you're not well. And of course, knowing that these are those people who then go there are those who feel well, but then there can still be those who might go there and suddenly become symptomatic later, and you are now a close contact, and that is why contact tracing is also vital, because if you were there in that area and you could have been exposed, then you might be contact traced, and you should also be given the proper notice if you should be quarantined. All of these forms were given due attention by the National Privacy Commission. And the National Privacy Commission ensured that the data we asked for is just what is needed. Second, all these forms should be secured and confidential to the person who should be handling this form, and he should be handling it for 30 days, and after 30 days, it should be disposed of. If you want to ask, what if it's needed after? Binilang na ho yan ng DOH. Sinabi hanggang 30 days, okay na po yan. And again, for privacy and confidentiality, it should be disposed of after 30 days. This is the first pass, like we said, if you had answered yes to the health declaration and you're in that holding room for isolation, if your company would not have a health practitioner, they can call 1555. It is working. This is the DOH hotline. So they can help the company properly manage the person who was held in the holding room if he has to be brought to a health facility, or if it's not COVID related but he has to go home, then all of this advice will be given by calling the hotline of the DOH. When you feel unwell, so now let's go to the second portion on the management of this whole guidance and management of asymptomatic and symptomatic individuals at work. Diba, I already said our general rule is I'm unwell, I do not feel well, I will stay at home. But having said that, your company, you should have telemedicine or teleconsult services na rin. Let the workers know that if they do feel all of this, they're not sure, or they had a close contact, they know whom to call. And that is what we are just saying here. Please have these kinds of services available. Then what if, paano yung micro? Kaya nga sinasabi din natin, pwede na silang tumuloy sa barangay health center. Sabihin ng owner, kung na pumasok, tumuloy ka na sa barangay health center para mabigyan sila ng tamang abiso. Now, if you're not, if you have HMOs, usually nagta-telemedicine na yan, but as physicians, if you're the company physicians, if they do not have an HMO, then have the telemedicine, teleconsult facilities. This is the second isolation area. The first is a holding room. Now, is this the same? It can be, but this is a little bit more, not naman sophisticated, but this is where you truly isolate na workers who do not feel well, or workers who have been swabbed and have to be isolated because they are going to be monitored, especially after, while they're waiting for the results. And we're saying here, it is mandated that if you are the medium large and with assets of 15 million, you should be having an isolation area of 1 room per 200 workers or 200 employees. It is not the company clinic. You can have, we heard like in other regions, they have tents already. It can be together with other companies. It may not be just you alone. And we're also opening this to other arrangements. You can have arrangements to have boarding houses for this or other LGU facilities. In fact, if I'm not mistaken, this is also part of the clarificatory guidelines. So you can make other arrangements. Pwede rin hotel. And sinasabi nga namin, arrangement lang naman sa hotel. Sabi nyo, yung mga hotel, ayos syempre ng mga COVID-related. That's true. But if you work with the Department of Tourism, and we already talked to them, they already have identified hotels who allow that their hotels will be isolation and quarantine facilities for COVID. So we work, you can tell that to us, and we can work with the Department of Tourism if your company would like that they would make this arrangement with hotels. So it's open. But again, in the clarificatory, we always saying that even the temporary treatment and monitoring facilities of the LGUs can be considered as long as it's nearby din naman. You don't send them off so far away, but have them nearby. And remember, these are for workers who really need to be quarantined first, because at home, they might also be infecting their families, especially if they already have symptoms and they're just, they have been tested, but they're waiting for the results. So this is a bigger isolation. It's not big, but it's like you're really providing a room, and of course, bathroom. It can be shared if it's, they're the same type of workers who are just waiting or just having symptoms and are waiting for the test. But the DOH was saying, if you're not sure, just make sure that when you use the bathroom, it's disinfected before and after the use. If we talk of these toilets in these isolation areas. And this is what we're saying. If you're unable to establish an isolation area, you may make arrangement with a temporary treatment and monitoring facility. I think it's already more popularly known as the TTMFs, nearby or with the barangay local government unit for the immediate referral of employees who need to be isolated. Contact tracing is truly important even in workplaces, and it is now your duty as the safety and health person to do this. You do not wait for the community to do this. It is your responsibility to contact trace. It is very important to stem the transmission, because if you have a positive, you want, of course, to isolate already those who might be also be the source of future transmission. And that's why that contact tracing is truly very important, and you're identifying close contacts. And this has already been identified. To PCOM, I've seen the algorithms even early on after the first interim. I was so happy with it. It's still here. It's still the same. And this is still what we define as we define close contacts. You identify this because you would like that as long as if they're close contacts and you now have a confirmed case, they shall have to undergo a 14-day quarantine period. And the first bullet, what we're just saying is, how will you identify close contacts? I hear pala, I am not sure. I think you already finished your contact tracing program here for PCOM, or you opened it. Sana you can have it again, because I really would like to also join that kind of a training and a webinar, because we have to learn from the experts who are doing the contact tracing. So what are, you can share that with me later, as we talk about how is contact tracing done. We're saying, of course, the interview, of course, the CCTV, and there's a ratio. I think now you're doing for one positive, they should find 37 close contacts. How will you do this? And that is, the reason why we are looking at what is the manner, what is the mechanism. Please now, as PCOM and as the safety and health people here, if there are webinars, please look at and join these webinars on contact tracing. It is very important. Now, for those close contacts and doing the quarantine of 14 days, please have the diary. You will have to be reported. You will be reported to the barangay, and they will also watch out for if you need to be tested or you just need to be quarantined. So, and when you're on the quarantine, watch out for symptoms, watch out for fever, because if you are asymptomatic for the whole time, you will need that certificate before returning to work that you truly were asymptomatic, and now the barangay will attest to this and give you a certificate that you will present as you return to work. On testing, please read this together with the DOH 258-A, 258 and 258-A, and our clarificatory. Actually, the clarificatory of 01 was to say that please use the 258-A. What we mandate for testing are for symptomatics and symptomatic close contacts. Otherwise, we are talking of that expanded testing strategy of the DOH that is looking at testing to be done. And these are the workers who are identified in 258-A, the regularity of the testing, and that this can be reimbursed sa PhilHealth as long as they're, of course, the accredited PhilHealth laboratories. So we're first on employees in the hospitality and tourism sectors. They can be tested once every 4 weeks. May be tested po ito, ha? It's not mandatory. Then you now have it was also written separately. If please look first on the left hand slide of the slide, and it says now we're looking at the export processing zone. Employees of manufacturing companies and public service providers. So they're in manufacturing, they are working with public, they're public service, and they're in economic zones in a special concern area. They may be tested once every quarter. So hindi namin sinasabi, lahat ng nasa PESA, lahat ng workers nyo ay pwede na hong matest every quarter. Unang-una, manufacturing, there is exposure to the public. Third, they're in a special concern area. I will define a special concern area later. Now, let's now go to the list of the economic priority workers that have been identified in the DOH 258A and who can also now be regularly tested. But again, look at the requirements. They're in the high priority sectors. The next slides will show you who are these workers that were identified in the high priority. Both public and private, they have high interaction and exposure to the public. As to what I showed you in the PESA, there is that exposure and high interaction with the public, and they live in a special concern area. Now, they may be tested also once every quarter. So, hindi ho lahat yan. And these are now the priority sector group. Those in transport and logistics, those are the drivers, conductors, pilots, rail operators, delivery staff, and all of this. Let us go, before we continue with the list, what is this special concern area? Regions with high prevalence of COVID cases. Definitely NCR. Tingnan nyo na lang po ngayon, yung mga nag-GCQ. Kasi wala na ho yatang, may nag-declare ulit ng MECQ. I think Tacloban had to be declared. But the higher Qs, would be the special concern areas. Or if you're now on a lesser Q and there was no reported in the big region, but in your area, there was now clustering, meaning may households in that area that test positive, it is also a special concern area. And if these special concern areas have been identified by the National Task Force. So this will limit as to where we are looking at in terms of sino rin doon pa rin ang matetest. So you have to be in the special concern area category. These are the other priority workers: food retail, waitress, waiter, waitress. You can see the list. In education, the teachers, the guidance counselors, the librarians. In the financial services, the bank tellers, non-food retail, the cashier, the stock clerks, the retail stock clerks, as long as they're still those who have high interaction with the public. But if they're stock clerks and they just, have interaction with their stocks, hindi na siya kasama naman po. Mauubos kasi talaga ang pondo ng PhilHealth kung wala lahat, natin lahat yan. Then the market vendors, those who do services, the hairdressers, barbers, manicurists, embalmers, morticians, parking lot attendants, security guard, messenger, ushers, even the clergy. For construction, take a look at all of these construction workers, including the civil engineers, structural engineers, construction managers, even the crane and tower operators. Then you have those in water supply, sewerage, waste management, the plumbers, the garbage collectors, water engineers, janitors, and the frontline, and then the public sector and mass media. So these are identified as the priority workers. Now go to the next category. Do they have high interaction with the public? And third, are they in a special concern area? So they may be tested regularly once every quarter, and they will be reimbursed by PhilHealth. If you want further tests, then it's really up to the companies to provide and to pay for these tests. Now, testing of symptomatic and close contacts, this is where we're saying ito na yung mandatory. If you're a close contact and you now have symptoms, please, it is mandatory that you should undergo RT-PCR. There will be, I have to say this, even the DOH will come out with the omnibus testing guidelines very soon. And this is also looking at testing, using antigen tests of the domestic travelers, international travelers, but for the workplace, they're not promoting still actually antigen is not going to be a substitute. It could be an addition, or if you're going to use it there, that's why they have the algorithm flow chart here. But for workplaces, they are still sticking to the RT-PCR because they said we do not have enough data to look at antigen testing at workplaces. So because of that lack, they're still looking at RT-PCR. So, and this is where it's mandatory. There are some workplaces who say they will mandate all mass testing for the employees. It is really discouraged. Number one, we've seen the problem that if you're going to do this, and this has happened for certain workplaces, and because of one case, they said, oh, let's just decide and let's do everything. They never coordinated this with the LGU. And then all the workers, after they tested, they let them all go out. Okay, it's fine, just go out. But then they had positives when the results came out. Then those workers became sources of infection in other workplaces. And that was where the problem started. So, yes, if you have to do, like you saw the frontline workers testing for the, if they have to be tested, and we're not talking of mass testing, it's really good if they can be isolated waiting for the test. But they're saying also, because the prevalence really is not that high, if they're not close contacts anyway, they may be allowed as long as you follow the minimum public health standards. Let's wait and see how it is written in the final omnibus testing guidelines for workers and workplaces, as the DOH is coming out with this, I think, by next week. But for now, it's like, if you do the test, please make sure that they are isolated first, because you really do not know who will test positive as you have the asymptomatics. Now, testing of symptomatic and close contacts, we already said if you're symptomatic and you're close contact, you should be tested. And you shall now have to undergo, of course, the 14-day quarantine. That is now after all symptoms have subsided. Again, read this together with 198-258 pala, -A, because it says if you have symptoms, you will be discharged, like from a facility, or brought down to a step-down facility if you already have no symptoms after 3 days. And if you are already without symptoms for 3 days, you can now go on the 14-day quarantine. And after that, then the clearances can then happen. So that is just what this slide means, you know. From symptomatic, there will still have to be quarantine periods. Workers previously symptomatic shall undergo the 14-day quarantine. If no new symptoms manifest, worker can resume work without the need for testing. This is, even if you test positive, remember the DOH protocol now is that there is no need for a second test. Even if you test positive in the beginning, you do not need a second test if you are asymptomatic for 14 days. And even for the symptomatic, again in their protocol, if you have no more symptoms, then you did the 14 days, there is no more need for the second test. In fact, the DOH did come out with a memo telling the laboratories, please do not do testing just for recovery, because they are now saying limit the testing for, of course, the diagnosis, but then just to prove that they have recovered. You know, the problem with testing, I think we all know that now. You've been through all of the webinars. Number one, it's a point in time test. So you test now, you're negative. Later, you have exposure to a positive. You might test positive after, you know, when you will be tested after tomorrow, after you have been exposed. Second, you may, you know, you have tested positive after your quarantine, you're asymptomatic, you can still test positive because you have the viral residue. It's not saying that you have the infectious viral particle, virus present, you now have the residue. And that's why you can still be testing positive even if you are now no longer infectious. And of course, for people who have to work, please understand why it is very important that we understand what this science is telling us now, and why we are not looking at the second test anymore, because it can really be positive, and he has been asymptomatic naman the whole time. He is already labeled as recovered. For again, the stand is that RT-PCR, antibody-based test, and I think even antigen tests, if it's going to come out now, are not recommended nor required for asymptomatic employees returning to work. Ibig sabihin, when we're opening to the, you know, from an ECQ, and then where there was, we limited going out to work, and now you can go back to work, testing is not needed as long as you have no symptoms and you were not exposed to any case, nor did you travel to any area where there were COVID cases. The OH committee, that you saw that earlier, that is still the same slide that where we put in the OH committee together with the safety officer. reporting should be done. Okay. I think it will come out in the testing guidelines on where to report. And I will share this with you now because that was a latest information given to us by the DOH. Yes, you will report to the LGU your worker for the LGU under the jurisdiction of the workplace, even to the close contacts and the symptomatics who are present. You will report that to the LGU, and you will also report to the barangay where the worker had most of where he spent a majority of his time. Kasi residence ba? Boarding house ba? Una, ang pagkaano namin is both. So you will also report to the barangay of the boarding house and the barangay of the residence of the worker. Pero I think it's going to cause confusion in terms of contact tracing and validating. So that's why they said now, you only report to the barangay where the worker had most of his, where he spent most of his time in. Kung sa boarding house, before, just before he got tested and was positive or as a close contact, doon lang sa barangay na yan. You do not have to report anymore to the barangay of the residence of the worker unless he is spending both times there. Then maybe you will have to report still to both. But if it is really more of the time that he's spending in the boarding house, then you will just limit then it to that area. So it's just going to be reported to two. In terms of the residence of the worker, saan ba siya namamalagi ng matagal? Yan ang sinasabi. So kung hindi na yung residence, doon na lang sa boarding house. Or yung temporary area kung saan siya namamalagi. But it has to be reported. Please understand, there is a responsibility in reporting. You have to report. It is part of that Republic Act on reporting, and there are penalties if you do not report. On disinfection, and again, the clarificatory here. Sinabi nga naman natin dito, if there's a COVID case, yes, it should be disinfected. Ngayon, ang dami na nagtanong, opo, narinig ho namin kayo. Sinasabi ng kumpanya, at talaga naman naglilinis kami. Iba ho iba yung janitorial cleaning every day. Iba din naman yung kasi may COVID case na, which would mean more extensive disinfection. And we understand, yes, that you do have this. Companies already have this. They have a means of really fully disinfecting areas. And when we say it's an area, yes, we are now looking at selective. And that's why the clarificatory will say, is it only in that work area because you have identified na doon lang naman siya? But if it's a cluster, then you might need, to disinfect a larger area. And you will complete other areas where hindi naman pumasok yung worker and there would be unaffected employees, tuloy pa rin ang trabaho doon. So you're not anymore talking of the closure of the entire building in the clarification. And we're not anymore talking of the full 24 plus 24 hours. Hindi na po. We leave it up to the company as long as when the inspectors come, you can show them naman your disinfection procedure. And you can show that the inspectors na you are saying that after disinfection, those who go back to work in that area, hindi na sila maapektuhan ng kung anumang chemical ang ginamit nyo. So it is here yet, but wait for the clarificatory because this has really been addressed. But again, if you read the supplemental, it also talks of selective na rin. It says, yes, you have to do, if there's case clustering, then you will also disinfect a larger area of the workplace. But we're also saying that companies can really develop your own policies on temporary closure. It depends now on what your disinfection procedure is. And you can still ensure in your company policy, because if it's not affected, then continue work because there should be continuity of operations. And that is also, of course, in line na rin with the National Task Force guidelines on critical zones, on the zoning strategy na yun lang, dun lang naman yung granular lockdown nga tinatawag. Selective lang. On leaves and absences, what is required by the labor code is still what should be applied. If you are sick from COVID, yes, good, you will have the SSS sickness and medical benefits. If it is work-related, you can have the EC. If you're going to be hospitalized, and then of course the testing, if you're symptomatic, PhilHealth will kick in. And ang mahirap dito would be the close contacts who did not test, who did not test positive, and uh, or are negative but had to be quarantined kasi no work, no pay na yan. And that is where, you know, in a meeting just recently, the government was really, ano nga ang mangyari dito? Kasi yung ano nga we have to, these are, i-quarantine mo, and sometimes nga sabi nga nila, because of that no work, no pay, talagang pupersa nila na bumalik sa trabaho, which is what we do not like to happen, because they really need to be isolated and quarantined, especially if you're a close contact of a confirmed case. And that is why here in the slide, we're saying, sana for the employer, they can still provide additional na to. Additional HMO benefits, especially kasi I heard that, you know, those who have been hospitalized with COVID, the hospitalization costs is above 1 million. I think for PhilHealth, it is less than that. So there are really expenses that will be shouldered na by the worker. And that's why if companies can provide more, that would be very welcome for the worker. Now, what we're saying here is the supplemental pay allowance, quarantine leaves. We heard that. Calamity leaves. We also heard that as another practice. That provides the addition, you know, for those who have to go on quarantine, the close contacts, meron pa rin silang income na makukuha. Some provide for the full income, their daily wage for the quarantine. Some have said, we can only provide now like a 50% of the daily wage in the quarantine. But this is, wala na, no work, no pay. So if and all the leaves have been consumed. So these are additional. And this is where we're still trying to, you know, ask employers, please try to provide this benefit, because they have a family also to support. And they were also looking at sino na magpakain. You know, if they're in the temporary treatment facility, nando naman yung accommodation. It will be answered for by the LGU or, you know, whoever is in charge of the temporary treatment facility. But paano naman yung pamilya? And we're still exploring that. It is a very difficult situation. The DOLE is also looking at this as well. So having said that, I think that's the last slide. Yan. You have any more questions? Clarificatory. Advisories are still coming out. If you think you still need other clarificatory advisory, but let's keep it to that muna, because I think the DOH also has its own interim guidance that will come out as well. So thank you again to PCOM. Thank you for inviting us. And I'm open now for questions.
Okay, thank you, Doctora. That was very enlightening. Sige po, while you're inom lang po muna kayo ng water, ay open lang muna namin yung poll namin, Doktora, para makaano po kayo. So before we start our open forum, i-announce ko muna yung result ng ating survey on the profile of our participants for tonight, no? Para maka-breathe muna si Doktora. Okay, so please scan the QR code to access the survey, or you can go to the www.menti.com and please use the code 5287076 to access the survey. Para makilala namin po kayo kung saan po tayong industriya, kung sinong mas maraming mga saang work po, no, force, kung saang workforce po tayo na bibilang, no? So, ito po. Let's go to www.menti.com. So we go there and then it will show, please enter the code, no? So you enter your code, which is 5287076, and then you submit. And then it has a question here, which, how many employees are in your company? O yan, sagutin, then submit. Then, anong industry sector does your company belong to? Okay, dalawa lang po, no? Ang tanong pala doon, no? Sa ano, so, okay. Okay, nakapag-ano na po? Okay, eto na sila. Thank you so much. So, I'm reading here right now. How many employees are in the company? You have 67%. Ayan, umaangat pa, 68 at 200 and above po na workers. You have 19, umaangat yung 20% at 10 to 99. Pareho lang po sa 100 to 199 at saka 1 to 9 po na workers, ang 7% naman. So, nag-increase 66, 67. Oy, ba't bumababa? Nalilito ba siya sa kanyang workers? Ayan, ayan. Is this it? Steady na? Okay. Steady na at 66% po sa 200 and above. Ay, nag-67 pa. Okay. So, can we check the industries? Menti code, please. Sige. Mukhang ano pa, lumalaban pa ang 200 and above. Okay, 67, 68. Okay. We're here now. Oh, bumalik tayo sa Menti code. Here's our code again. 5287076 at www.menti.com. Okay. So, are we ready to share in the screen yung ating results? Okay, thank you. No, habang inaantay natin yung result, I would like to say thank you to everyone who participated tonight. At this time, we have 227 participants, no, na naka-register here sa ating Zoom. Very interesting and talagang napapanahon ang ating topic for tonight. So, okay, final na? All right. Sige. So, how many employees are in the company? You have 69% at 200 and above. So, 16% at 10 to 99. So, mas marami pa rin po yung 200 and above, no? So, sumusunod yung 10 to 99. The next is, ano kayang mga industry? All right. So, here we go. The industry sector your company belongs to. So the highest is, the 27% is the human health and social work activities. Marami tayo dyan. Sama na po ako doon, 27%. You have 25% at manufacturing. Okay. 15% in construction. You have 11% in professional, scientific, and technical activities. 8% at financial insurance activities, 6% at wholesale and retail trade, repair of motor vehicle and motorcycles. You have 3%. Oh, let's go to 4% first. 4%, no. You have 11%. Sorry, nalaktawan natin. Itong pro, ito. Sa ano to, web, sorry. Okay, so you have 4% at education, 8% sa financial and insurance activities, 3% electricity, gas, steam, and air conditioning supply, and Last but not the least, 2% po sa Public Administration and Defense Compulsory Social Security. Yan po. Okay. So, we are now ready for our open forum. Dr. Cucueco Asek, are we ready na po for the next part of our webinar? Thank you, Dr. Asek. Andito na po, ang daming mga katanungan po na ika-clarify, although it's a very insightful po yung lecture nyo na sabi nyo po lahat. Na-clarify nyo po, no? If I may recap, yung like yung signage must be prominent, and there's a, if it's a 15 million na asset po, yung company, sana po yung shuttle nga po, no? Can we, mag-open na po ako ng mga katanungan na excited na po silang marinig yung mga sagot po. Doktora?
Sure, go ahead. Sige. Please, go ahead, please. Oo,
alright.
Go.
Okay, so ito po, no? Random to, Doktora, sorry, hindi ko na na-categorize, but let me start by
Yes, go. Sige
regarding
po.
face shields in the workplace. Can we recommend eye protection like goggles? Instead, if they are wearing surgical mask and N95, this is a hospital setting, but concern is with the back offices and outpatient clinics. Thank you.
Okay.
So is there any option? Although nabasa po namin na yun nga, yung visor, hindi nga po recommended, but how about the eye goggles?
Ganon din yun. Kasi, yes, nandun naman, the face shield for the eye, that protection is there. Pero to add on, diba sinabi ko nga kanina, na kung N99, fine, but to add on, kasi you said surgical mask, I was nga thinking, I saw that already, and I was thinking, if you're now on the surgical mask and it's like a 70% or even 80%, the facial will add on to a 90+% of a protection. And when you deal with, and when you interact with your coworkers, of course, that is something, that additional protection is of value. It's almost like 100%, then you put physical distancing, you're really adding it more and more pa. So we are saying, please use the full face shield, because you're not just protecting your eyes, you're adding on another barrier or another protection, even to the nose and to the mouth.
Okay, thank you, Doctora, for answering the question. I will try to yung mahimay ito na yung makapag-imagine tayo ng pag-walkthrough ng workplace. So simulan ko po sa may mga company pa rin po na may iba na yung pinapausukan yung empleyado. Yes, may mga misting, may ganun po. Opo, paano po yun as disinfection nila? May mga salon na ganun eh.
Sige, disinfection ba to o yung pinapausukan dahil may ubo?
yung disinfection po, Dr.
Disinfection yan. Sinisigurado ko lang kasi iba na yung pinapausukan. Sige. Yung disinfection by misting, kasi it really, the DOH also came out, talaga aangkla din kami naman sa sinasabi ng DOH. People can react to that, and it may react adversely pa. So we're not anymore advocating the use. And besides, it has, in fact, if you read and this was really a case, a death of in the armed forces yata, who went to and was exposed to that kind of a misting, and he was pala reacting, he had an adverse reaction to that. So kaya i-avoid na lang natin. So we are not really, I know some are still putting it out there. In fact, if you see DOLE, meron ng ganun pero sinabi ko, bawal na nga yan. But for those who still want, because they've done it and they're not affected, you go ahead, but that we're not really saying that's going to be good for all. We're not allowing that talaga.
Okay, thank you so much, Doc. With regards to naman po, rapid and swab, I know we are pro for the swab testing, but there are companies pa rin doing rapid. paano po kaya ang i-stand namin as a company physicians po? Kasi mahirap po
Okay.
kailangan
Oo.
din namin
Ganito yan,
makisayaw.
alam nyo naman, alam nyo na yung stand dyan. Ang dami nyo kung binabasa ko rin naman yung mga binabasa nyo eh. Di ba? Rapid testing, unang-una, the rates of false positivity, false negativity is really high. And it will also give you a very false sense of ano. And that's why even the DOH has said, wag na tayong mag-rapid test. In fact, we already moved to of course, the gold standard is the RT-PCR.
Yes.
The antigen test carries, pero there's also an issue sa antigen because sabi nga nila, yung sensitivity is good. It's the specificity that is being questioned. And that's
Yes.
why if you will see the protocol, because I've seen it na rin, for those who will test negative for the antigen, you will need a second pa. Kasi nga negative yung doon ang nagiging parang 80% yata ang problem ng the specificity of the antigen test. So let's not talk na muna of the rapid antibody test. For those who want, it's not going to give you any information at all. And besides, sabi nga nila, kung mag-positive ka doon, mag-PCR ka, kawawa talaga, kawawa yung mga tao kasi sometimes ang magbabayad pa noon, yung empleyado, parang doble-doble. And why? Why pa talaga? Is it just for mass testing to make sure? But it's not really going to give you any good information at all. So let's just avoid it.
Okay, thank you, Doctora. Now, since andun na po tayo, Doc, no, sa sa testing and so on, there are companies that they're doing their own quote-unquote guidelines and protocols, and there are others na maybe they're not really familiar with our DOH guidelines. Meron po yung ino-observe muna yung influenza-like symptoms at kapag may certain hour yata sila or araw na kapag okay na and not following the quarantine days and so on, pinapapasok na po. Hindi na po sila kina-quarantine, ina-isolate. Let's say, binibase nila as a normal, sipon lang yan, observe natin 3 days or maybe 24 hours. Pag hindi ka na nagtuloy, pumasok ka na. Paano po yung mga ganun? Kasi sa mga companies din, sabi nga nila, ang workers nila ay kailangan na kailangan nila. So, nag-iiba po yung ganun. Paano po kaya yun?
Ganito, may COVID tayo ngayon, di ba? If we were just not in a COVID period, I think you can even straightforward answer that, but we're just being precautious. We are going to be very overly cautious here, especially because COVID-like symptoms and influenza-like symptoms may mimic each other. And ang sinasabi nga natin, sige, if you're not sure, then, pero the isolation, i-isolate at i-quarantine mo na. Tapos, then you observe. If you know and then dapat meron din silang consultation. If you're a physician and you're watching, if it doesn't get any better than you might as well ask na. And these are symptoms, because ang sabi nga nila, RT-PCR may also may have false negative. It's done early. But if there are already symptoms, then you can really, then the RT-PCR will really truly pick out the positives. So you watch out for that, and the timing of the test is very important. But start the quarantine and the isolation. That is really, alam mo, i-quarantine and isolate. Maski COVID yan, ha? Na hopefully mild lang yan. When everything will subside and he will be well, and then you quarantine him for 14 days, edi okay na. But then, like we said, stop the spread, stop the transmission. That's why, again, I will ask that please quarantine and isolate them, but make sure you also have the next steps. You are going to really rely on your best clinical judgment and do it. This is COVID. And you cannot also waste time, because if they will go, symptoms can drastically change in a day. And that's when maybe you would like also to put in the need for the test na, and to further advise them, especially if their symptoms get worse. But first and foremost, quarantine and isolate na.
Thank you, Doctora. But what if the company allows it? Sila mismo nagmamandate. Hindi, Doktora, nandyan ka naman. Pwede
And
na
then,
po yan.
alam, doktora, pwede ba sabihin mo sa kanila, ako ho yung doktor. Yung nyo na yan.
Salamat
You have
po.
to take on your responsibility na po. You have to really tell and you have to inform them and they have to value what you will tell them. And I think they will value it when you say, yung isa hong yan ha, pwede yan, mag-i-infect ng ilan. Tapos ko pinapasok ko yan at ano yan, ang close contact niyan araw-araw. Nako, doble na, sir, ilan ho ba talagang ayaw niyong papapasukin? Lahat ba ng worker? Baka umabot ho tayo dyan. Oh. Diba?
Thank you. Tama po, doktora. Now, if the patient po is symptomatic for 4 days, tapos nag-okay na po, kailan po ba talaga yung counting ng 14 days? Is it from the day 1 nung symptoms po or from day 1 ng asymptomatic na po siya? Medyo ano po, para clarified.
Oh, sige ha. We will read it together with 258 because I read 258A.
Opo.
Symptoms. Wala ka ng symptom ha. Tapos na.
Opo.
Ang 3 days of no symptoms ang sabi. So, for caution, kung itong Lunes, sa tingin mo wala ng symptom, baka mayroon pa.
Opo.
At Tuesday talaga wala na siyang symptom. Umpisa na tayo sa Tuesday. Walang symptom. 3 days, no symptoms. Tuesday, Wednesday, Thursday. Tapos magbilang ka na ng 14 days na quarantine. That is how I read the 258-A. On 3 days, no symptoms, then step down, and then step down, go now to the 14-day quarantine.
Okay. So parang ano po, I'm sorry, doktora. So from 3 days na walang symptom plus 14, ganun po ba?
Yes.
Okay. So parang 17 days po naka-quarantine. Ay, okay po.
Pero yung 3 days kasi na no symptoms, kasi galing hospital, minsan sasabihin nila, o sige, kasi punuan eh. O pwede na siya sa temporary treatment monitoring. Kasi wala na siyang symptoms. So sa 3 days, baba mo na siya sa step down. Sa step down, di wala na nga talaga, 3 days wala na. O i-home quarantine mo na ng 14 days.
Okay. Thank you po, doktora. How about yung mga may ano lang po, tawag dito, nag-symptoms lang po ng ubo-sipon, ganun, pero wala naman po silang exposure sa positive.
Hindi mo alam, di ba? Hindi mo alam yung walang exposure. Ubo-sipon is ubo-sipon. And that's, you also don't know. Kaya nga sabi ko nga, quarantine mo na lang.
Yes.
Quarantine mo lang. And then observe. Kasi kung in the next day, ubo-sipon nga talaga at nawala na, edi observe. And then, clinical judgment nyo na yan.
Okay. Now, Doc, syempre, nandun na tayo sa part ng quarantine. Hindi po ba dapat yung patient ay kailangan nagre-report din po sa birth? Ngayon, meron po kaming mga difficulties on convincing the patient to report to birth kasi ayaw nga raw sila ng exposure, tatakot sila, ang dami, meron pang reporting na nagsara daw yung birth kasi sila mismo daw ay may positive sa loob. Paano na po yung mga certificate na ganun, doktora?
Natanong sa akin yan. And I'm glad when that was asked of me, I was with the governor pa. And because he was there, kasi ang masarap doon, ang maganda doon, pina-attend niya lahat ng city health officer niya, provincial health officer, kaya sumagot sila. Kasi ganun ang tanong. Na lockdown si Bert, kailangan niya ng certificate. Sumagot naman si city health office. Lahat ng hawak ng barangay, hawak din ho namin. Kaya magbibigay ho kami ng certificate kung naka-lockdown siya. At pwede pa po online yan. Laguna yan.
That's nice.
Online pa daw sila. I-check nyo yan.
Opo. So, paano po yun? Asek? Kailangan talagang may certificate ang worker, di po ba? Kasi yung iba ang sinasabi, meron naman kaming clearance sa specialista namin. Bisita, doon na lang kami nagpatingin. Hindi pa po ba enough yun?
Kasi naka-report ka rin sa birth. So it's really just getting that kasi because you reported the birth, that's kaya sinulat na rin namin yan. You have to be reported then, and that's why you will get that clearance. I-report nyo talaga yan. Kasi kailangan bantayan din siya ng LGU. Lalo na ngayon kasi, our cases are still not
Opo, totoo naman po
there.
yan. Opo, totoo naman po. Ang dami pa pong katanungan. Doktora, okay pa po ba kayo na
Sige
magsagot
lang.
pa? Sige po.
Sige lang.
Opo, bale ito pa ho. Ito naman, ang isa pang tanong po. Regarding po sa, ayan na, nasagot na natin yan, yung clearance sa ano po. Ito naman po, meron din palang mga barangay health response team na nagre-require ng rapid testing bago sila mabigyan ng certificate.
Alam ko yan. Alam mo,
Opo,
kaya
ano po
nagugulo
kaya
din kami minsan sa DILG eh. Para bang, and then even, even the DILG, they're so surprised these barangays would have that. Ay nako. But these are the barangays.
Yeah, and they're not gonna be given certificate if they're not gonna follow through. Tapos rapid test pa.
Oo nga eh.
Opo. Paano po kaya itong ganito po? Pass muna po.
Pass muna dyan. Ito, tanong nyo sa City Health Office. Ganito. Di pa validate mo. Tawag ka sa City Health Office kasi yan naman dun sila kumukuha ng kanilang abiso. Kapag sinabi ng City Health Office, hindi na ako kailangan yan. Sabihin mo, ba't ho hiningi pa ho sa amin? Baka gusto niyang kausapin. Kasi it's not only there, pati yung sa mga logistics, sa tracking, yan na lang hinihingi ng barangay. And that's why we have to work with the DILG most of the time, to straighten up and harmonize policies. We're really sorry. But, because policies are so, and they get, lalo na pag LGU na, sometimes they're not, they do their
ang hirap
own.
nga po eh. But anyways, Doc, paano kung halimbawa, yung pasyente po or worker po, natapos na ang quarantine period niya ng 14 days, pero tuloy pa rin po ba? I'm sorry, I have to rephrase it. Natapos na ang 14 days, pero meron pa rin siyang signs and symptoms, kailangan ng another 3 days na asymptomatic para maging fit to work or another 14 days po yun, Doc?
Oo, di ba symptoms? Ang usapan na, COVID positive? O symptoms?
Ito po, asymptomatic lang po. Asymptomatic na nagkasakit. Pero tuloy-tuloy siyang ano pa din. Wala naman exposure halimbawa po.
Asymptomatic na alam mong negative.
Opo.
Sure ka negative, ha? Kasi
Opo, sige, para ano po?
You will handle it like, an influenza case or and i-monitor mo. But kung may symptoms talaga pa, huwag mo muna papasukin talaga. Na asymptomatic, negative, ha? Negative ang usapan natin, na hindi positive.
Opo. Yes. Negative.
Negative. Huwag mo muna, habang may symptoms, huwag rin muna. Kasi mga hawa din yan. Kung ano man sakit niya, hahawaan din niya yung iba. Ayaw mo rin naman yun. Kasi papakabahin mo rin yung iba.
Opo, totoo naman po yun, Doc. Paano po pala, kapag meron pong halimbawa na meron pong patient, negative naman sa swab, nagpatingin po sa espesyalista, asthmatic patient, na bigyan po naman ng gamot, and ang sabi lang is may resume to work. However, nung upon interviewing napapasok siya sa company, meron pa rin po siyang mga simptomas at nawawala lang po ito kapag naggagamot yung patient ng kanyang maintenance. Papapasukin pa po ba siya? O ano na lang po, work from home na lang po talaga siya?
Asthmatic siya, di ba? So, yes, he's now part of the vulnerable. He has a comorbid. Ikaw ba? Kasi kaya nga sabi namin as long as bibigyan niya ng fit to work. If fit to work niyo ba yan? Kung fit to work niyo yan, mapasok yan. Kailangan niya magtrabaho. But if you can give him and he has an option to work from home, it's really best that he will work from home. Especially mukhang natitrigger to. Kaya hindi nawawala ang symptoms.
Opo. Totoo po yun. Ngayon may tanong po ito na Doc, marami pa. If company physician, may ganun po if company physician works from home temporarily, with the consent naman daw po ng company, is it considered counted hours daw sa OH requirements? Ewan ko kung maano yan, kasama yan.
Yung sa 8 hours na work niya. Kasi di ba,
Yes.
naman nga tayo, di ba, sabi natin pwedeng outsource yan, 8 hours,
Opo.
Nasa usapan niyo na yan ng
Ng company.
na
Tama po.
company. Oo. Pag sinabi niya, sige, oo, tas counted yan. Oh, di, good. Nasa
Opo.
usapan niyo na yan. Huwag na natin, ayoko rin kayo pahirapan.
Salamat po. Oo. So ko lang, reiterate ko lang, Doc, no, kasi very crucial. So bago papasukin yung worker na diagnose as na merong influenza-like at na-quarantine po for 14 days, kailangan po talagang nakapag-report sana siya sa BIRT at kasama doon sa clearance niya kung nakapagpatingin siya sa specialista rin sa labas, yung BIRT clearance niya po.
Yeah. Especially, kaya ni-report niyo yan sa BIRT dahil may close contact yan, ha? Pero kung hindi naman yung close contact, hindi niyo na-report sa BIRT, huwag niyo na pa-report sa BIRT. Wala man siyang report, di ba? I mean, hindi niyo naman,
Opo. What should we do if an employee still refuses to undergo on RT-PCR despite having flu-like symptoms and just insists on undergoing 14-day quarantine? Ayaw po nila mag-test. Kasi syempre baka sagot nila or something po.
It's number one, sana nyo na PhilHealth na magbabayad, may symptoms na siya eh. So babayaran ng PhilHealth. Second, please consider that you have to tell him it's also for treating and managing him properly. Kasi don't you also want that? Kasi may symptoms na to. Buti kung but he will have to be managed properly, and the test, that is the value of the test. Diba? That is really the value of the test.
Okay. So, it's already 8 p.m. Doktora, napakaraming tanong talaga, but kung na lang, i-email po namin sa inyo mga katanungan po, no? Any last words po? Asek, maraming salamat. Any last words po?
Kasi meron lang akong dito, ganito ha, ang antigen, I'm not sure, kasi ang maganda sa kanya, it will pick out the positives. Ang mahirap sa kanya, the negatives, because that is where they were seeing that may percentage siya na nagkakaroon ng false negatives. But in terms of picking out the positives, it can really be very high, almost like to 100%. That's why maganda din sana ang antigen test. Pero we cannot say it's going to be really like a substitute, sabi nga ng DOH, adjuvant testing.
Opo. Sa ko lang siguro, Doc, mas more clarification pa, Doc, dun sa 14-day quarantine of the influenza-like, because some companies are getting tired. Actually, yun ang tawag ko doon, na nag-aantay, ng mga workers nila na 14 days kasi may ubusipon nga naman na talagang agad-agad 14 days. But there are workers that are important in yung role nila sa company na hindi nila kayang mag-antay na wala yung worker. So parang yun siguro ang mahirap talaga as a company physician na i-convince yung mga companies. So Doktora, maraming salamat po sa sa inyong napaka-insightful lagi na webinar. Meron po ba kayong pabati or last po?
I just thank you lang. I will always say these are opportunities for us to touch base and for also me to see your concern. Gawin nyo na lang yung yung contact tracing. Sasali ako dyan. At saka yung sa gabi. Gawin yung gabi. Wag yung, kasi nakita ko meron kayo Dapat it was in the morning and it was may conflicts ba? So sabi ko, just sayang naman, di ako makasali. But usually, pag gabi na, okay na. I mean, hindi rin. May mga gabing mahirap.
Opo. Totoo naman po yan.
I would like to join. I really would like to join.
Thank you. Don't worry. Gagawan po namin yan ng webinar and you are already part of it. Kasama ka na agad.
Contact tracing na yan. Gusto ko talaga matuto dyan.
Ako din po. Totoo po yan. No po. Maraming salamat po. No? Thank you, Dr. Tess. I don't think we will be having a photo op pa. Parang hindi yata kakayanin. But thank you so much.
Sige, mag-photo op na. Okay lang. Wait, kasi baka gusto nyo din okay lang. A few more, it's just a few more, less than a minute siguro. Bilisan nyo na lang sa gallery.
Ay, okay po. Opo. So ano lang, magbati lang po ako, Doc, no? Mag-closing remarks lang ako. Paantay lang
Please.
saglit po. No? Okay po, salamat po. So, maraming salamat po sa mga nag-participate ngayong gabi. Sana marami tayong natutunan. Mangyari po ay huwag munang umalis. No? At magpo-photo op tayo. Ngayon, kung to formally end tonight, educational activity, ladies and gentlemen, our chapter vice president, Dr. Jeremiah Martin Florante.
Oy, vice na pala si Jing.
Opo.
Hi, Jing. Vice ka na! Buti na lang, nag-wait ako hanggang marinig. Sige, Jing. I will listen.
Nahiya tuloy ako.
Hoy, wag! Namimiss ko naman kayo, oh.
Thank
Nasa
you.
office ka? Nasa office ka, Jing!
Opo.
Oh my God!
Opo, ang sipag niya po.
Oo! Sino
Thank
katabi
you
mo,
very
Jing?
much. Okay. Thank you very much, Dr. Ako. Thank you very much, Asik Cucueco. Actually, since the start of this pandemic, the lives of every Filipino worker has been put to a test. Workplaces had been suffering setbacks affecting our economy. Various government agencies belonging to the Interagency Task Force on Emerging Infectious Diseases had been coming out with guidelines protecting the welfare, safety, and health of every worker, preserving to some extent our workplaces, and sustaining our economy. Tonight's discussion is one of the products of these untiring efforts of our government to save our workers and the economy. Thank you again, Assistant Secretary Maria Teresita Cucueco of the Department of Labor and Employment for gracing our regular Kapihang OH time and again, and sharing to us an in-depth discussion regarding the recently issued DTI-DOLE Joint Memorandum Circular number 20-04-A. Assistant Secretary Cucueco, our deepest gratitude. Allow me to thank as well the energetic officers and members of both the national and chapter boards for your active participation in our tonight's educational activity. Thank you too to the men and women behind this Kapihang OH online edition. You are the reason of the successful virtual Kapihan. I would like to acknowledge also our institutional partners who believed and are believing in our advocacies, to our fellow advocates in occupational safety and health, and to all our friends who joined us here tonight. May all the knowledge we have gained tonight be shared to our colleagues at work once we go back to our respective workplaces, either physically or virtually. To all of us, congratulations and thank you. This is not the end, as we have many more in store for you. Always remember that in Quezon City chapter, we value your safety and health. Hashtag PCOM QCC cares. Mabuhay tayong lahat. Good evening.
Okay, good evening. Maraming salamat, Dog Ching. That was a very inspiring na message, no? So, mga ka-OSH, this is the time na magpi-picture taking na tayo. If you can open your cameras and smile, our technical team will do its best na makunan lahat because we have so many participants. This is to be taken by our beautiful and talented Secretariat, Dr. E.C. Escobillo. No? So, siya na po ang magka-count. Steady lang yung mga ngiti natin. Okay? I know nakakapagod, pero saglit lang naman po ito. Muli, maraming salamat sa pagdalo sa inyong lahat. See you again on our 21st Kapihang OH. Ako po si Dr. Margo Venus Ku. Parating nagpapaalala sa inyo na ang kaligtasan at kalusugan ay mahalaga. Good night, everyone, and stay safe and healthy. Because hashtag PCOM QCC cares.